you are still a great parent. Whether you choose medication, therapy, or both, don't feel guilty about it. Medication is not about weakness, it's about wellness. You're not questioning it if your child needed medication for their cancer treatment or for their diabetes. They need to be on insulin, they need to poke themselves. You're not questioning it then. So why are you questioning it if they need it for depression, anxiety, ADHD, trauma, PTSD, OCD, or whatever is going on?
Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and inspire joy. Be empowered to balance your mental, physical, financial, aspirational,
and social health while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. If Joy, and I'm here to help you transform life's challenges into opportunities for joy. Let's begin the journey together. Hey everyone, we are in episode 113. Medicate my kid? You must be crazy. Separating facts from fear in your child's mental health journey. And this episode, I'm just going to tell you, is pre-recorded because by the time you're watching it, I will be in Orlando getting ready to go on a cruise, a much needed cruise. So there you go. I'm a child psychiatrist, as you know, also an adult psychiatrist. So when you come and see me, you can get medication for whatever you need. And I chose this topic today because a lot of times people are like, I don't want to go to the doctor to get medication. We were talking about that just last week. We were talking about should you just pray about it versus getting medication. So this is a very good segue into this week as far as medicating kids. What? Where does that come from? How dare you? Did I go into psychiatry or child psychiatry just so I can give pills to kids? No, not quite. In fact, I spent a lot of time with my kid patients to make sure, do they actually need a medication? And the other thing is that there's not a lot of child psychiatrists out there. As many as I know, I feel like I'm surrounded by them. There's only a handful of us. So there's not even enough people that actually have the expert education to even be able to prescribe medication to kids. So I'm just like, let me be a part of that so I can be a part of breaking down that stigma and a part of making sure if a kid needs the medication, they get the right medication. Because a lot of times there's that misdiagnosis and they're getting the wrong medication that they shouldn't even be getting. So there is definitely a lot of myths when it comes to prescribing kids with medication. You're afraid, right? It's like, my child to be labeled if they're on medication. The medication will change who they are. They'll become dependent. A lot of parents talk about that, whether will they become dependent? Will it change who they are? Well, first of all, as far as changing who they are and their personality, there's no medications that actually change personality. Some people would wish there's a medication that changes personality, but that's not the case. But it changes the thing that you are hoping to address, right? And this isn't to say that, oh, let's just go straight to medication. That's not what this episode is about. It's to calm your fears or worries or stress about the idea of your child being on medication. If your child is sleeping well, eating well, making good grades, no issues with friendships and things like that, of course you shouldn't be thinking about medication. If there are issues with grades and behaviors, aggression, suicidal thoughts, and having symptoms that are disrupting their life, changing who they are, and that aggression is a big piece, right? If they are a danger to themselves or a danger to others or self-harming and have been through therapy multiple times, multiple therapists, multiple years, and the therapy is just not cutting it, or that IEP, that individualized education plan, or the 504 plan, or whatever accommodations that you are trying to do is just not cutting it, that's definitely a good time to think, hmm, should there be a medication out there for my child? The fear is also about, like, what are these medications actually doing and what are they for? When you think of ADHD, the stimulants that treat ADHD are working on dopamine. Dopamine is activated when we feel rewarded or when we get a reward or we're anticipating a reward. It's that dopamine that's released during excitement, during sex, during comfort food, during drug use, unfortunately. So it gets released when there's something in your body where you're getting that reward or that high, or it's released when I'm going on a run and getting that runner's high. So dopamine is the medication that is worked on in ADHD to increase it because it stimulates you to focus and pay attention. So there's biological, biochemical evidence of why it is actually working. And honestly, it's not a miracle pill that, okay, once I take this medication, everything's great. I have had some patients where once they take the medication, they're doing just fine, but you still have to include the therapeutic strategies with these medications. Treating anxiety and depression. Antidepressants are medications that work on your or help you with anxiety and depression. And that's your serotonin, that's your norepinephrine, the SSRIs you may have heard of, like Prozac, Zoloft, Lexapro, Celexa, Cymbalta. There's so many of them, and they work on increasing serotonin, and then the ones that also increase serotonin and norepinephrine. So there's neurotransmitters in your brain that it is helping release because it is evidence that serotonin can improve depression, improve sleep, reduce aggression, and improve anxiety. So that is why these medications are at play. Again, not just the medication. There are people that want an easy fix. Let me just pop a pill. I don't want to do the work in therapy. But I'm talking about therapy all the time on this podcast, how it's work. You have to do the work, the introspection, the looking into yourself and your trauma and processing all of that. And how can you recognize your triggers and what you need to do once you get a trigger? They go hand in hand. Research shows that therapy and medication have this synergistic effect. That medication alone is good. Therapy alone is good, but together, it's amazing. Therapy doesn't really have many side effects. I mean, I've talked about the only real side effect is that once you start talking about that stuff that you got buried and baggage and all that, you start to feel it. Those emotions come out, that PTSD comes out, that depression, everything comes out in the beginning in therapy. But the more you talk through it, the more you develop coping skills and strategies, you start to feel better. Of course, medication, it's working on chemicals in your brain. There's chemicals in your brain and receptors in your brain that are doing other things too. So serotonin is released out of the brain. It's also in the stomach. In fact, we learned a couple weeks ago that 95% of your serotonin is produced in the stomach. I didn't even realize that. Anyhow, because the medications work on receptors that are not just doing things for your mental health and it's doing things for your digestive health or other parts of your body, then that's where side effects come out. So, for instance, with antidepressant, somebody might suffer from upset stomach. They might. It says it's a common side effect, but most people say they don't get it. But yes, I do have a fair share of patients that do have the upset stomach. And then there's that long list. You look at all the commercials where they talk about, oh, feel better with this medication, but you can get this. And you're like, whoa, why would I give a medication like that for my child? I wouldn't even want to take that for myself, let alone my child. Well, all those this thousands of side effects is because they have to do research on thousands of people in order to get their medication FDA approved. So when all those thousands of people are taking the medication, that one person over here suffer from that thing. This certain percentage suffer from this other side effect. these small amount of people suffer from this side effect. So the side effects are coming from different different amount of people suffering from a different amount or types of side effects or adverse effects. So then they have to list all of those. Maybe some are more common than others. Maybe the common ones are common because it was like 10% of the people or 5% of the people, but the other 95% didn't get that, right? So that's why there's that long list. So that can be scary, but to be honest, the most common side effects or the most common medications that I prescribe are actually pretty tolerable. The antidepressants and the ADHD medications, as scary as those sound, they're more tolerable. For the stimulants with ADHD, I mean, the most common thing is loss of appetite, and you do have to worry about that in children. If they have a loss of appetite and they're actually not eating, you worry about them stunning growth. But that's where I work with the pediatrician, right? Making sure they're getting those visits in, getting vital signs. Of course, the vital signs are because stimulants can affect the heart. If you think about when you drink coffee, you get like jittery and it might make your heart skip a beat. Probably shouldn't be drinking coffee if that's the case. But the same way coffee is a stimulant, stimulants like Adderall, Ritalin, Vyvanse are stimulants and can affect the heart. So those are questions that we ask, questions that you should be asking before putting your child on a medication about side effects. I'm always reassuring, hey, you don't have any personal cardiac history. They don't have any personal cardiac history. They should be fine. If there is any concern, we get an EKG to look at their heart. If there's concern, and there's actually somebody saying, no, you shouldn't be on stimulant, there's multiple other types of categories of medication someone could be on for ADHD or for depression. There's always something else. And then there's different types of therapies if that doesn't work. But it can feel scary, like putting your child on a medication. I get that. And I reassure people all the time, hey, this is particular medication. I have 3 boys. So I'm not trying to just put medication on anybody. And if there's a medication that is needed in my patient, I ask myself, would I prescribe this to my own kid? Would I feel some kind of way that my own kid is on this? And I usually think about that when it comes to antipsychotics. An antipsychotic is used to treat bipolar and schizophrenia. Children don't quite have the schizophrenia diagnosis or the bipolar diagnosis. You start to see that maybe new onset psychosis or episodes of bipolar in teenagers or young adults. But antipsychotics are given when there's a very severely aggressive child or they have disruptive mood dysregulation disorder. They're constantly irritable, aggressive, oppositional, all those things. Or it's given to children who are autistic and have agitation or behavioral issues, severe behavioral issues. So it's not always because they have schizophrenia or bipolar, but antipsychotics act as a mood stabilizer. So I got on antipsychotics because those are the ones where I'm just like, we got to really think about this. Does this child really need an antipsychotic? Are they hallucinating? Do they have severe aggression, severe behavioral outbursts constantly, and no therapy has helped? Okay, well, you still have to worry about side effects. Increased risk to diabetes, increased risk to cholesterol or high blood pressure, weight gain, all those things. But we start with a tiny dose if it's definitely needed. There are lots of different talks about foster kids getting started on the wrong medication just 'cause. So they come to see me, they're on all these antipsychotics. 1 to 2 is all to me because, like, you really shouldn't be on more than 1, definitely. But I see a lot of foster kids on more than 1, and that's not good. How did this happen? What are we overlooking? Why are they on an antipsychotic? This person's not aggressive. They're not even hallucinating. They're just saying that they hear the voice of someone that died, and you put them on an antipsychotic? So I do a thorough review of the child, what is going on. A lot of times in foster care, there may be some aggression, some pushback, some anger, some opposition, some defiance. So then you gonna put them on an antipsychotic because they had trauma? So being trauma informed, you being trauma informed for your child and realizing that maybe their anger and aggression is not because of bipolar or they just have an anger issue. Maybe there's trauma. Has your child experienced trauma? Has there been a loss? Have they been bullied so much that obviously that's a trauma or neglect or parental divorce or anything that to them is a trauma? But especially in foster kids who are not being raised by their biological parents, even if that's the only thing that happened, that they're just raised in multiple different houses. Usually there's other traumas. It's not just the fact that they're not growing up with their parents, the reason why they're in foster care. But just foster care alone is an adverse childhood experience and a trauma, and they need therapy more than anything. So you definitely have to watch it and ask the questions, right? What is actually going on with my child? What is the root of all of this? More so, majority of the time, I'm not starting a medication on the first day, but I will if there is so much aggression. Like, unfortunately, I hear about kids beating up their moms, they're eloping and running away and causing disruption to property or hurting teachers, adults, or kids, siblings, whoever. Those are the kids that we want to use everything, therapy and medication and accommodations and certain types of supports, right? And so it is important to continue to bring them to the provider, to continue to assess, do they really still need this medication? And that gets lost when it comes to foster kids because the second provider, the second foster home, they just think, "Oh, that's the medication that they should be on." Then they tell the provider that, and then they go to a third foster home, and then the provider's like, "Oh, I guess this medication must need to be increased. Let's just add another one because that one's not working. We removed the first one, and it seems like they needed a little bit, but it's not 100% effective, so we need to add a second one. Okay, let's add a third one." And no one's really assessing and seeing, do they really need it? And so I love deprescribing. I actually get excited when I see a patient with like 5 or 6 medications because I'm just like, "Yay, now I get to figure out which medication you don't need to be on," because for the most part, you do not need to be on 6 medications. So this whole fear, it's a matter of finding the right provider who's going to listen and do a thorough review of who you are and what you've been through, your family, your genetics, and all those things, being trauma informed and realizing, "Okay, it's trauma." Because if it's trauma, therapy, 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 or something more gentle like an antidepressant versus throwing an antipsychotic at you. And it's so important for you to educate yourself, asking the right questions when it comes to your child. Why are you putting my child on this medications? What are the other options beyond medications? What are the side effects? How long do they have to be on it? Will they be on it for the rest of their life? And when you go and continue to ask the questions and continue to get them assessed, then you can start to trial them off and wean them off when they're doing well. Now, ADHD, depression, anxiety, usually not on those medications for the rest of your life. Research shows that you should be on an antidepressant for at least a year of doing well. So if your child's been on it for a few months, you're like, "Oh, they're doing well. Let's take them off." They're doing well because they're on the medication. Don't take them off. Talk to the doctor first. And it's important to know that being on a medication for at least a year while doing well helps reduce the likelihood of relapse. So if you stop the medication before that, it increases the chance that they can become more depressed or relapse into a depressive episode. So that's why it's important to ask the right questions and know. And these medications, of course, for anxiety, depression, ADHD, parents get concerned. Are they going to get dependent on it? Will it be hard for them to get off of the medication? especially Adderall, Ritalin, like, "Whoa, adults get high on those. What if my kid gets high?" Usually for the kid, you are responsible for their administration, and you make sure they take the medication when they need to and they don't have it on them. But typically for kids, they don't become dependent, and majority of ADHD kiddos on stimulants are off of it by the time they turn 18. Usually those hyperactive kids aren't hyperactive once they graduate. Maybe the inattentiveness continues, but a lot of kiddos are usually grow into not having ADHD. Of course, there's those who continue and may need to be on it. But are you trying strategies outside of medication? Are you in therapy? Is your child in therapy? If there is something severe going on, crucial crisis, they were hospitalized, they were put on medication, and then they were discharged on medication, and then now they're in the therapy, now they're continuing to be on the medication. A lot of times it's needed to be on medication just in that time frame while the therapy is able to work. That's another thing. The anxiety might be so high or the depression is so high that they have blinders on and that therapy is not doing anything. So that happens where I need to prescribe a medication so they can be able to focus on therapy and be able to not be so anxious that they're able to understand and use and practice the coping skills, especially with exposure therapy. Exposure therapy and anxiety. If your anxiety or social anxiety is so severe that you can't even go out the house to do the strategies, you need a medication for that. And speaking of medication for anxiety and whether you get dependent, definitely in children, that's the one thing. Benzodiazepines, Ativan, Xanax, Klonopin, I am not prescribing those in kids and teens. I do not like doing that. So that, I'm there with you. Like medicate my kid, you crazy. Ativan, Xanax to my kid, you crazy. Yeah, I think so. There's those severe cases, severe intellectual disability, severe aggression, severe autism, where you might see that kind of medication because they tried everything and nothing seems to help. Okay, sure. But yeah, not for your bread and butter anxiety. I am not putting them on that. In fact, in my private practice, I don't prescribe those controlled substances at all for anxiety. I'm starting to do the stimulants in my private practice. I do stimulants all the time at Chris 180, but yeah, therapy, doing the work so that once you develop those skills, maybe by the time are able to reframe your mind, the child's able to reframe their mind, they are able to do without the medication and not depend on it, but they can depend on their own self-care and coping skills. So that's why it's important to track the progress of what is going on. Continue to go to therapy, continue to follow up with the psychiatrist. If there's side effects, talk to the psychiatrist. Don't just stop it. Don't just stop it or don't double it up because you feel like it's not working. It's a partnership, no pressure. When I recommend a medication, I can't force you. I can't force it for the child. There are some frustrating cases where it's kind of like the child's cutting, suicidal, not showing up for class, very depressed, bullied, things like that. And the parents still don't want to do medication. Those are frustrating when they still don't wanna do it. But I mean, it's my job to continue to educate them and reassure them, answer their questions, and let them know it's okay. It's not forever to be on a medication, but we weigh our risk and benefits. Risk and benefits. By the time I'm prescribing that medication, I've already outweighed the risk and benefits. That benefit of being on a medication outweighs the risk. And that's important to know because I know a lot of you parents are like, okay, what's up with this black box warning on antidepressants? Why are you going to give a medication to my kid that treats depression but causes suicidal thoughts? What's that about? Well, what is it about? Well, I said, I was talking about research, right? It all goes back to that. 2004, there was a research study where the group of people who were on the medication 4% had suicidal thoughts, and a group of people not on a medication, 2% had suicidal thoughts. So it's kinda like both groups had suicidal thoughts, but since the other group was double the other one, 4% versus 2%, they were like, whoa, 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 black box warning. These medications can cause suicidal thoughts, but it's rare. The black box says it can rarely cause suicidal thoughts. So then psychiatrists were like, okay, well, we're not going to prescribe it as much. And guess what happened? Suicide attempts went up. So it's very important that we weigh our risk and benefits. That's actually my spiel that I tell parents every time. Because if a doctor is giving you a medication and they are not telling you the side effects, run. You need to know the side effects. So I make sure my parents know about black box warning, side effects, all those things. So definitely it's important to not feel pressured into do your own self-care as a parent so that you can calm your own guilt with putting your child on a medication. Don't feel guilty. We have to use our resources. You want to do prayer? Do prayer. That's perfect. That's going to help your kid, but maybe your kid also needs therapy and maybe your kid also needs medication, all the things. But look after you as well. That's what all this is about, prioritizing you so that you can be able to be there for them because maybe your anxiety is getting in the way of putting them on a medication because you're so anxious that something's going to happen. Go make that visit. You can come make that visit with me. DrEnjoyLife.com. I'll calm your nerves. So the takeaway here, you are still a great parent. Whether you choose medication, therapy, or both, don't feel guilty about it. Medication is not about weakness. It's about wellness. You're not questioning it if your child needed medication for their cancer treatment or for their diabetes. They need to be on insulin. They need to poke themselves. You're not questioning it then. So why are you questioning it if they need it for depression, anxiety, ADHD, trauma, PTSD, OCD, or whatever is going on? It's about their wellness and making sure they are better. And encourage open conversations between you and your child. Having a second opinion is okay. Focus on your child's joy and growth. That is what is important in making sure they experience mental wellness. So, medicate my kid, you crazy. No, the only person crazy is the one jumping out of a plane. I guess I'm crazy because I've jumped out of a plane. Yeah. All right. Thank you for listening. Go to my website, get inspired joy for the wife, mom, boss, balancing it all without losing yourself for $17.49 on DrEnjoyLife.com. And you can also get the Joy Bundle, Inspired Joy for the wife, mom, boss, plus the Enjoyno for $45. DrEnjoyLife.com. Thank you so much. See you next time. This has been an Enjoy Life production. If you're in a crisis, don't hesitate. Call, text, or chat 988 for immediate support. Please note, this podcast is for informational purposes only and is not a substitute for professional treatment. If you're looking for therapy or medication management through Enjoy Life, visit www.DrEnjoyLife.com to request a consultation. I'm licensed in 12 states. I accept Aetna in Georgia, Florida, and Virginia. Be sure to grab your copy of the Enjoyno to help you on your wellness journey. Also, check out Inspired Joy for the wife, mom, boss to help you balance it all without losing yourself. Better yet, get the full Joy Bundle for just $45. Remember, Journey to Joy Live is every Thursday at 7 p.m. Thank you for joining me, and until next time, may you continue to transform stress into joy.